Hi everyone, welcome back to Nurse Katherine here. Welcome back to another educational video. In today's video, I am going to be teaching you a very simple trick that you can do to prevent veins from rolling. You don't even need to use an IV kit to practice. You don't even have to try an IV to practice. It is so simple. So let's get started. Before I start, I have to give credit to the nurse who taught me this. I believe her name is Diane. I used to work with her at the old hospital I used to work at on the med-surg floor. She actually was a vascular access nurse. So she went around and put in PICC lines and other central lines for patients, and then got our really difficult sticks if we could not get them ourselves. So she taught me this trick and it has helped me ever since. I think I've only had a few veins roll on me. I think I've gotten almost every single time. Granted, I love putting IV sites in, and I used to put IVs in all the time in the emergency room. So I got really good at them and I got really good at this trick, but you guys can too with this really simple trick I'm about to teach you. All right, so I'm gonna use my arm as a demonstration here. All right, so as you can see, I have 1, 2, 3 veins here. One is pretty small. This one's in the AC, not always the best because it kinks the catheter. And then I have this one over here, which is a good one because you can go up a little further or down a little further to go into there. So let's say we're gonna go with this one over here. Let me pump my fist up a bit because I do not have a tourniquet on here. I just have some big veins on this side. So, as you're looking at this vein here, you can see that it does go down pretty far. Now, I do this with every single vein I ever poked because you don't know if they roll or not. You simply take your thumb, hold right below, and pull down. That is literally push and pull it down. Yes, it might flatten it out a little bit more, but it will help anchor the vein. That's what it's called, anchoring the vein. It'll help anchor the vein so it doesn't roll. It does get tricky and it does take a little practice when you're doing it, just because it does flatten the vein out a little bit. You could use your finger too. I always used my thumb. Say I was going to put an IV in on a patient, I would use my right hand because I'm right-handed and to do the IV, and then I would use my left hand, my left thumb, to wrap around the patient's arm, just like I'm doing here, and then anchor the vein down, and then insert my catheter below. You never insert right on it, you insert below it, and this is a pretty superficial vein, so shallowly go up to it. And then once you get your blood return, you can release. Or if it's a really swivelly vein and it moves around a lot, especially in your geriatric population, just hold it down the whole time until the whole catheter is in the arm. And guys, that is it. That is the simplest trick that can help you prevent your patient's veins from rolling. It has worked for me almost every single time, if not every time, and it really helps just using your thumb to anchor down on that arm, anchor down on this arm, whatever arm you're using. I have stuck feet before, which is not fun at all, but I have done it. And you can also anchor down on those veins too. So don't forget the anchor down technique, and it will help you so much. Let me know if this technique works for you, or if you guys know any other techniques to help from rolling veins. Other than that, that is it for today's video. I hope you enjoyed this. If you did, hit that like button. Also, do not forget to subscribe to my channel. All right, I'll see you guys in the next video.